Hello, welcome to Ask the Experts. I'm Claudia Otero. Today we're going to be focusing on a brand new weight loss program. It's called the Lifestyle and Metabolic Program, also known as the LAMP program. Our experts today are Dr. Joanna Oppenheim, Dr. Tarun Bajaj, and Michelle Roberts. Dr. Joanna Oppenheim is the Lifestyle and Metabolic Program Director. She is board certified in family and obesity medicine. Dr. Tarun Bajaj is the Metabolic and Bariatric Surgery Service Medical Director. He is board certified surgeon specializing in general, laparoscopic, and bariatric surgery at our hospital. Michelle Roberts is a registered nurse. She is also the Bariatric Program Coordinator. Thank you all for being here today. This is a brand new program, as I mentioned, so there's lots to inform the community, lots of great information, so we're going to get started. The Lifestyle Metabolic Program offers kind, compassionate, and comprehensive treatment for people living with obesity. The goal is for people to lose the weight, to keep it off, and therefore just live a healthier life. Dr. Oppenheim, I want to begin with you, and before we start talking about this program, let's begin with obesity. So this is the root of the problem, right? And it creates more problems. So can you talk about that?
I think of obesity as the extra storage of extra body fat or adipose tissue that disrupts multiple systems in the body that then go on to cause a lot of disease. When we think about obesity and how we define it, the way we usually define it is using a body mass index. It's something that most people are very comfortable with and knowledge about. It's your height and your weight. And a definition of obesity is a BMI greater than 30. There are some limitations with BMI, and sometimes it can, for instance, overcall it in a healthy individual that has a lot of muscle mass, or sometimes we can miss obesity when the BMI is in the normal range, but the patient actually has a lot of extra adipose tissue. So other ways that we can find people with obesity or diagnose them is by using body fat analysis, and we can measure how much body fat they have. And for men, anything greater than 25, and for women, anything greater than 32 is considered obese as well. A crude measure to know if you've actually accumulated adipose tissue in an unhealthy way is patients can measure their own waist circumference, and you can do this by taking a soft measuring tape and measuring by your hips. And if your waist circumference is greater than 35 inches for a woman or more than 40 inches for a man, you probably have obesity and some obesity-related diseases. Obesity is a big problem. You know, it affects 42% of adult Americans, currently 20% of our children, but that number is climbing very, very quickly, unfortunately. So it is a big problem in our community because having that extra weight when it's placed especially in the abdominal area, what we call visceral adipose tissue, is a driver of so many diseases. So what we know is that adipose tissue is very biologically active. It causes a lot of inflammation, which then can cause dysregulation in all of your systems, including the system that takes care of your blood sugar, your blood pressure, your cholesterol, even how your body manages abnormal cells that can turn into cancer over time. So this is something that we really want to address early, and we need to address because if someone has obesity with high blood pressure, just treating the high blood pressure is not enough. You need to treat the driver of the disease.
And you're doing that now with this program.
We're trying.
You're trying. No, you're doing a great job. But let's talk about the program now. How did it come about?
So I'm a family-trained physician. I've been practicing medicine in the area for about, more than 20 years now. And about 6 or 7 years ago, I was getting a little bit frustrated. I would sit with my patients who had a collection of many diseases that were driven by obesity. So high blood pressure, high blood sugar, high cholesterol, arthritis of the knees, sleep apnea, and I felt like I just didn't have enough time to talk to them about it. And you know, this is a long discussion, but our healthcare system is not really set up for that. So I went to the hospital, and they very kindly let me work on a program where we could invite patients to come to a 3-week class that we held every week for about 90 minutes. And I would talk to them about nutrition, activity, stress management, benefits of sleep, changing habits. We even did a cooking demonstration. My husband does that. And so that launched in 2019. And it was wonderful. It was a great way for me to connect with my patients outside the room, have enough time to answer a lot of basic sort of day-to-day questions. And then at the end, towards the end of the year, a lot of patients were kind of saying, this is great, this is a great springboard, but now what? So, and most of them, actually all of them said, I want to lose weight. And I thought, well, okay, this is complicated, and I don't really know that much about it. And so, fortunately, unfortunately, with COVID, I did have a little bit more time on my hands. And that was when I really delved into learning more about obesity, how to manage patients living with obesity. And it was a little bit of a shocker to me because I'd been in practice by that time for so long. I thought I kind of knew it all, and it sort of turned out I didn't. And so it was a wonderful way for me to learn more about this part of medicine, which has evolved very, very rapidly in the last 5 to 10 years, so I could better help my patients. And it was in 2021 that I became board certified in obesity medicine. And at the time, I was working in my primary care clinic, and one day a week, I would work with patients who were struggling with obesity. And the hospital was wonderful. I had this sort of dream about opening a comprehensive program with everything from nutritional counseling, the use of medications, behavioral techniques, and then eventually bariatric surgery. So this year, actually earlier this month, we opened our clinic, Lifestyle and Metabolic Program, on South Main Street.
Right. Congratulations.
Thank you.
Yes.
Dream come true, but it was really a phenomenal thing to come to fruition, because the one thing that I've really learned is this really is a community need. And you know, I'd like to think I'm a really good family physician, but this was not something I could do in addition to everything else I was doing in my office with my patients. It just required more time. And so I think having a dedicated clinic for this will really help a lot of our patients in our community.
Good. So you have this dedicated clinic, you have this beautiful new space. Tell us about the team.
I have a great team.
Who is a part of this team? Yes.
So, you know, I think that as anyone with weight-related issues will tell you, the more support they have, the better they do. So we have a team of great people. I have a registered dietitian I work with. We have one that gives classes for our patients that focus especially on nutrition and nutrition for life, and sort of a really good balance of nutrition and how people can eat to manage their obesity. I also work with another great nutritionist who helps us with our bariatric patients. We have a psychotherapist that we work with as well, that patients will see before their bariatric surgery for evaluation there, and some of my patients who really need a little bit more care will see him as well. We offer support groups, so we will sit with our patients every 2 weeks. The more support people have and the more they can learn from each other, the more benefit we see in those patients.
And how long is the program from beginning to end?
There is no end.
There is no end.
You know, obesity is a complicated disease. I wish I could say you get treated for 6 months and you're cured. The reality is that's not what happens. And what I have seen with my patients is what they need at certain points in their life, it changes. So you can imagine a 30-year-old struggling with obesity needs something different than a 65-year-old. A lot of it depends on their other medical issues, their lifestyle, you know, the stressors that they have, and those are all the things that we take into consideration, because our treatment has to be very individualized for that patient and for what they are going through.
Individualized care.
Mm-hmm. Yeah.
Okay. Well, if you want to schedule an appointment with Dr. Joanna Oppenheim, you can call her at the number on your screen. It's 831-208-6226. I repeat, 831-208-6226. There is another component to this, and that's bariatric surgery, and we are going to discuss that in a few minutes, but I don't want to jump ahead here. I do want to give you a sneak peek into this fantastic new clinic. Take a look.
Welcome to our new Lifestyle and Metabolic Program clinic located in South Salinas behind Ellie's Restaurant. Over here is our waiting area. This is where you will come and sit while you're waiting for your medical assistant to come and pick you up. Follow me down this hallway. You'll come over to this area that offers privacy to get your weight done, and then you will make your way down to the exam room on this side. We have 3 exam rooms in our clinic, and we also have a room where the health coach will see you. And then down here, these are the offices for administration, our obesity specialists, and the bariatric program coordinator. And then we have my office over here, which in my opinion is the best office in the clinic. This is our education room. This is where we offer monthly support meetings for our patients who are on their weight loss journey and for patients who have had bariatric surgery. We are very excited about our new location, and we look forward to seeing you. We hope that if you have questions or you're interested in losing weight, that you give us a call.
Michelle, thank you for giving us that tour. I can't decide. I mean, I like your office space, but I also like their office space, so I'm torn here. Hopefully you have some artwork now on the walls.
Some artwork now.
Very nice. Okay, well, you are the Bariatric Program Coordinator for the LAMP program. Tell us about your role and how is it that you help people?
So my role as the Bariatric Program Coordinator, what I do is I help patients navigate the journey that they start on really with Dr. Oppenheim once they decide to go to surgery or that they want gastric sleeve surgery. I help coordinate their appointments. I stay in contact with them while we go through their appointments and the workup that insurance requires to have surgery. I do their preoperative education, and I also talk to them about diet and lifestyle changes that they'll need to start making before they have surgery. So I stay in close contact with them. I also see them after surgery, and I stay in contact after they are discharged home.
Okay. This is probably a question that I should have asked you, Dr. Oppenheim, but if a person wants to join this program, do they need a referral to join, or can they just call and make an appointment? How does that work exactly?
So they need a referral from their primary care provider.
Okay. And if a person wants to have bariatric surgery, the referral comes from you. Is that correct?
Yeah, so one of the issues with bariatric surgery is there's different surgeries, and we want to make sure that the patient gets the right surgery for them and that they are a good candidate for bariatric surgery. So there's a whole checklist of things that we do. We look at, we have the patient complete lab work, a bunch of visits that need to be done to make sure that they're a good candidate, because we want our patients to have the best outcome that they can possibly have.
Okay, all right. If people need more information, if they want to contact you, Michelle?
Sure, if people need more information about the program, they can call me at 831-759-3057.
Again, I love the fact that you actually go visit patients right after they've had their surgery, so you're really there every step of the way.
I'm really there every step of the way, yes. I try to see them before they have surgery, the morning of, and then I usually am there in the evening and the next day.
Well, Dr. Bajaj, you are a very important member of this LAMP program. What are the benefits of bariatric surgery? I mean, you are already performing these surgeries, so what is the benefit?
The biggest benefit is the addition of having one more step in the lifestyle change that most all these patients want. And ultimately the goal of the surgery is to get them over that plateau and get to that weight, but also the benefit of hopefully not being diabetic anymore or not having high blood pressure and truly not having to take as many medications as they are. And there, of course, are other benefits that we're still realizing, including a decrease in the cancers that are associated with obesity. And by having this surgery, that risk of cancer decreases as well.
Oh, that's great. And what are the surgeries that you're actually performing now?
So there's actually 2 major surgeries that are conducted for bariatric patients, but the one that's performed at our facility is the sleeve gastrectomy. And so if they do need the other type of surgery, then we can get them referred to places that do perform that procedure.
What is that, the sleeve surgery entail? It's a tricky word, so I'll let you say it.
So it's either called a vertical band or a vertical gastrectomy or a sleeve gastrectomy. And essentially it's taking the stomach, which is normally a pouch type shape, and making it more of a tube-like shape. And so I actually take a portion of the stomach out, and essentially you're creating a long, narrow tube which of course decreases the capacity of the stomach.
This is not a major surgery, though, in the terms of how it may have been 10 or 15, 20 years ago, right? I mean, it's done in a minimally invasive way, is that correct?
So I do it laparoscopically, so there's much smaller incisions. It is a major surgery because it is a significant part of the stomach that's being removed.
Thank you for the correction.
In the general sense, no, it's not a major surgery.
When a person is getting ready to have this type of surgery, I mean, what do they need to do to prepare?
Luckily, the way we've set up the program here with the Lifestyle and Metabolic Program, we will guide you through the different steps. And once we determine that you are a good candidate for surgery, then I will be brought into the mix. And that means that you've gone through the steps that are necessary to get to the next step, which is the surgery.
I've read that one of those steps is that you have to lose a little bit of weight before you have surgery. Is that accurate?
Yes and no. It really depends on what comorbidities you have. Unfortunately, also the insurance that you have. So that's where Michelle is key, because she knows the ins and outs of each of the different steps that need to be taken for the individual patient. And so once we know that those steps have been taken, then I can perform the surgery.
Who is not a candidate for this type of surgery, and why? What would be the case?
So specifically for our hospital is the patients that have a BMI that's too great. They will not benefit from just the sleeve gastrectomy, and so they need to be referred for the gastric bypass, which is a more significant operation, more major operation than a sleeve is. And so we can get them in touch with a surgeon. Because of whatever other comorbidities they have, they would benefit much better in having the bypass done.
And I would assume too, just knowing them, and I think this is where you come in, Dr. Oppenheim, and even you, Michelle, too, is just you're getting to know them through the program, right? So you have to know whether or not this person is really going to be successful once they have the surgery, because there is a lifestyle change.
The way I look at it is too, I think with the surgery is, you know, like Dr. Bajaj mentioned, it's just a tool, another tool that we have in our toolbox to help with weight management. It doesn't mean that you get the surgery and you no longer have to make sure you get the right sleep, the right nutrition, the right exercise, the right hydration, you know, getting your mental frame, you know, your mind in a good state. It's really, really important that you follow the post-operative instructions. And this is where, again, Michelle goes through this with the patients. I go through it with the patients. I know Dr. Bajaj reinforces this over and over again, and as you'll hear from Andrea later on, we do talk about it a lot, because that really will dictate who has a good long-term positive response to the surgery. And I think candidates that aren't willing to do certain things, people who aren't willing to do certain things, are not good candidates for the surgery. We've had some people that we've worked up for the surgery, and you know, one patient didn't want to stop drinking soda, so that's not a good candidate for the surgery.
And so why can't a person drink soda or even alcoholic beverages after having sleeve?
The biggest reason is the amount of pressure that the stomach has, and now that I've decreased the size or the capacity of the stomach, that means that there's more pressure that's being put on those staples that I've placed, and so they can have leaks or other complications. And so the safest is to avoid straws or drinking through a straw, because it introduces extra air, but also carbonated beverages, same thing, it introduces extra air, which puts extra pressure on that whole staple line that I've placed.
So a person can become very ill just by having a couple of sips of whether it's soda or alcoholic beverages, or even using a straw.
Potentially, yes.
It's that serious.
Well, alcoholic beverages, we really discourage anyone who is trying to lose weight from drinking any alcohol. Alcohol and weight loss doesn't really mix very well. And because your stomach is smaller and alcohol is absorbed through the stomach, You could become a really cheap date after getting the surgery, and so it could be very, very dangerous, actually.
Yes.
So I actually discourage all of my patients from drinking any alcohol, definitely months leading up to the surgery and after the procedure, just because a little bit can be quite harmful. So if you're very sensitive to alcohol and all of a sudden a couple sips can make you very impaired, that's very dangerous.
Right. And I'm assuming, I mean, you really need your family's support too if you're going to have this surgery done and you're going to give up these things. You can't be going out and seeing and having alcohol around you or I assume that's...
Although I do try and encourage people, I think that people can have a really good, fun life without alcohol.
Yes,
so
yes,
we definitely encourage those kind of behaviors.
What's the recovery like after surgery?
Immediately post-operatively, I do keep you in the hospital for one night. I do a special exam to make sure that the staple line is completely intact. And after that, the lifestyle, because you have a smaller capacity, you will go through the whole protocol that we'll explain as far as having only 30 mLs of fluid and then working up to when your body is ready to the clear liquids, full liquids. And so as far as the surgery goes, because it's the smaller incisions, hopefully the pain is a lot less than having a bigger incision, number one. But also you can start doing a little more as far as your activities goes and getting up and moving around with having the smaller incisions rather than the larger ones. Immediately after discharge the following day, the recovery is slower, but I expect my patients to be up and moving around. They'll follow up with me about 2 weeks later just to make sure that everything is healing properly on the outside, and that gives me a clue of how everything is healing on the inside. And then we'll continue to follow you as a team through your whole course. And again, there is no end. And so we will continue to follow you even after the surgery's been done and after you've attained the weight loss. We'll continue to follow along to make sure that you stay on course.
Well, we're now going to hear from one of your patients who recently underwent sleeve gastrectomy surgery. Take a look.
I decided to do the bariatric surgery at Salinas Valley Memorial to better my health and to live a healthy lifestyle. I think the program is awesome. They have taught me between food, nutrition. They teach you everything and they are 100% supportive. They have taught me everything about cooking, exercise.
Andrea came to me a few years ago stating she was ready to work on being healthier. Over the years we worked on small changes that she was able to do, which was great, and she was started to lose weight and she was feeling great. And then her weight plateaued, and we talked about different options, and we talked about surgical options as she was interested, and she decided she wanted to have the vertical sleeve gastrectomy.
I go in laparoscopically, meaning using small incisions to go inside the abdomen, remove that portion of the stomach, and essentially make your stomach more of a tube like the rest of your intestine. The result of this is that you will feel less hunger and feel full quicker and remain full longer, thus enabling you to lose additional weight.
It is a serious surgery, but if you do all the prep work correctly, follow all your surgeon's directions, I was completely fine.
She went in with her eyes wide open. She was very clear on her lifestyle that she would have to follow after the surgery for the surgery to be a success. And she understood that having the surgery is just another tool in her weight loss journey.
I went in on a Wednesday, July 13th, and I went in at 10:30, and I think I was back in my room by 12:30 with Dr. Bajaj, who performed the surgery. My 2-week follow-up, I had lost 20 pounds.
Well, joining us now is Andrea Schlegel. Thank you for being here and sharing your story with us.
Of course.
Well, how are you doing after surgery? I mean, you look fantastic. You're smiling, you're sitting there, you have your care team with you. How's it going? How are you doing?
It's wonderful. I feel absolutely wonderful. I have a great outlook on life and I feel great.
What was recovery like for you?
Recovery was simple.
Okay, you have to elaborate. We want to hear more. How simple was it?
It was, went into it thinking, you know, surgery, recovery. I was back the next morning home walking my laps, doing what the doctors required and asked of me, and I was doing it.
Okay.
And I had no complications whatsoever. If you follow what the doctors and the program asked of you, everything went fine. I had no complications at all.
So how has your life changed since you started the program and obviously post surgery?
My life has changed 100% for the better. I look forward to every morning to wake up. I started wanting to have my life better, to make it better for the future and for the present. And I came to my primary care doctor, Dr. Oppenheim, a couple years ago and said, it's time. I want to make a change for the better. And she helped me along. And then they started this program and she included me. And so I started the program and I lost some weight on my own just for starting, and then I plateaued. And then she introduced me to all of these people, and they helped me. And I'm in 100%. And I now they taught me how to eat, how to exercise, how to change my whole lifestyle. I am no longer in the previous lifestyle. I'm in a new lifestyle, and I'm happy to be in it. And I no longer take medicine for high blood pressure.
Wow, congratulations, that's great.
Cholesterol. I'm no longer pre-diabetic. And it's all from learning how to eat properly, exercising, and learning about the human body from this whole group of about 7-10 people, and them teaching with all their knowledge of going to school. They're teaching lay people like me how to live a wonderful life and be healthy.
And that you are, and you're actually running after your grandson, you said earlier, right? So tell us about that. How has that changed? What could you not do before, and what are you doing now?
I couldn't walk a block. I'm telling you the truth. I'll be truthful. I got up to 323 pounds. I've now lost 100 pounds.
Wow.
And I can run after my beautiful grandchild. We can go to parks. We can go to aquariums. And I wake up every day with joy and thankfulness in my heart that I truly want to be around. I'm 58, and I want to be around for another 30 years. And I just want to tell everybody in this community, come to this program and make your life better.
I should probably add that you're creating these beautiful memories with your grandson, and that's really special.
I want to see him go off to college. And before, I don't want to damper, before I thought I couldn't make it there. Now, I'm going to be there first in line.
Right. We love hearing that. And look at the smiles here. Everyone's smiling. They're supporting you, and they've seen you go from there to this. And
yes.
Wow. Okay. Any advice for people out there who are struggling, who maybe cannot walk a full block?
Yes. Your first thought would be to call your primary care. Think you're worth it, first of all. You are. Every human is worth it. If you have low self-esteem, if you think you're not worth it, call your primary care. They're the ones with big hearts and surgeons that are kind, and people like Michelle that will not judge you. They're here to help your life be healthy. But make that first step to join the LAMP program, and they will teach you everything about a lifestyle that's healthy. And it's actually, once you're doing it, it's easy. It's actually easier and tastes better to eat healthy. I'm not a doctor, but just me, I feel like a new person, and I wake up with abundance of energy. And I just want people to take that first step to call their primary doctor.
What's been your favorite part about the LAMP program?
When you're very obese, your self-esteem is low. Whereas you guys are not obese. When you have obesity, your self-esteem is quite low. And you don't want to hear a doctor, but they're non-judgmental, this group of LAMP. So if anybody is on the fence, I want them to know you will not be judged. They just want to help. So my advice is to give them a call. Give Michelle a call. And she will not judge you. And it's wonderful for Monterey County residents or Santa Cruz or whatever county. This group will help you.
Well, thank you for sharing all that. We're very happy for you and that you're doing well. And the smile, you walked into this room and you were smiling and glowing. And so thank you for being here. Dr. Bajaj, Dr. Oppenheim, when your patients, I should say, when your patients have undergone bariatric surgery, I mean, how do you make sure that they stay on track? And you talked a little bit about this earlier, but can you just elaborate more on that type of care post-surgery?
Go ahead.
Yeah, so our goal with this program is ongoing care. So one of the things that I see a lot as a primary care physician is patients who've had bariatric surgery years ago, maybe a different county, different state, and their follow-up is not very good. And these patients have undergone significant surgery, and they do need monitoring of their blood counts, their vitamin levels. You want to make sure they're taking their vitamins appropriately. And as I said earlier, because obesity is a chronic disease, it's something that needs to be managed over time. And the times that I recommend patients come in the most is when they feel like things aren't going their way, when there's weight regain, when they're struggling for some reason. It's like Andrea said, it's hard to come out of that alone. And the more people you have supporting you and that can help you in a way that works for you, the more successful you will be as an individual. And so follow-up for patients, I think, is very important. We know from data that patients who lose follow-up or touch with their bariatric surgeon or any kind of obesity program will gain weight because it's not being monitored. And so one of the things I encourage all of our patients is regular follow-up. And you know what? If you're doing well and it's an easy visit, it's great. I get to see how happy you are and how life is. And if you're not doing well, great, then it's time to brainstorm and figure out what's going on here. Let's catch it early, let's fix it before it becomes, you know, a 100-pound weight regain. And then you're kind of where you started in the beginning, and it is much harder for the patient. You know, my goal for my patients who end up through this program, whether you started, whether you were young, middle-aged, older, is what I want for all of my patients. You know, I want you to live the life that you want to live. I don't want you to be restricted in any way because of a medical condition or because your body is not fit enough to walk or climb a mountain or travel. I want you to learn how to fuel your body with the right amount of food, the right type of food when you need to be fed, not any more, not any less. I want you to be able to move your body in a way that keeps you healthy. I want you to be sleeping well, and I want you to be metabolically healthy. And most importantly, I want patients to feel like they have control, like if their hunger isn't controlling them, they have control about how their lifestyle is, how they live their life, and then they can live their life to the fullest potential. It's not up to me to tell you what kind of life you want to live. You need to decide that, but it is my job to help you do anything you can to live that life so that you're happy. I don't know how long any of us have on this earth, but we want to make sure that every day is great. Like, how lucky would it be if all of us woke up every day like Andrea? To wake up being happy and grateful, if you can do that, there's probably nothing else I need to help you with. Right?
Be out of business.
I'll be out of business, right?
After that.
So, I mean, what a wonderful way to live life. Like, I'm listening to you and I'm thinking, wow, if I could do that every day, like, life is great.
You've changed her life. Well, you changed your life. I mean, really, you're the one who went through the process, and with a little help. Is there anything else you'd like to add, Dr. Mish?
No, I think the big thing is, like Dr. Oppenheim said, is that what I do is just one of the many tools that you have at your disposal if you were part of this program. And so come to the clinic, and then we'll determine if surgery is the right step for you. And it could be or it couldn't be. No judgment. We will get you to where you want to be.
Well, to schedule an appointment with Dr. Joanna Oppenheim, please call the number there on your screen. It's 831-208-6226. I repeat, 831-208-6226. You can also call Michelle Roberts if you're interested in bariatric surgery. Her number is 831-759-3057. It's there on the screen. 831-759-3057. Well, thank you all for being here today. It's been a nice chat we've learned a lot and heard a lot of exciting things about the LAMP program. So thank you for everything that you're doing. And this video will live right here on our Facebook page. So please like and share it, and please share it and like it. We want everybody to know about this wonderful program. It really, as you heard here earlier from Andrea, it is changing lives. You can also follow us on Twitter, LinkedIn, and Instagram. I'm Claudia Otero. Take care.